Hey guys, welcome back to my channel. It's Jessica Ward King, the StigmaCrusher here. Today we're going to talk about a topic that is very highly stigmatized. And luckily we get another 3 years here in Canada to think and talk about it. But unfortunately I fear that in these 3 years we won't do a whole lot of talking about it because of the stigma. And that topic is medical assistance in dying. So what's been going on is the idea was put forward that, well, right now we have medical assistance in dying in Canada. And medical assistance in dying has been called many, many names because of the stigma surrounding it. One of the better known names, I suppose, that it's been called is doctor-assisted suicide, or just assisted suicide. And so what it is when a patient who has met all of the criteria that is required by the medical and licensing board is given medications by a licensed physician, and all of those requirements include being assessed by one physician and then being assessed by another physician independently, and both physicians have to agree that the candidate or that the patient is a candidate for the procedure, and they have to meet a bunch of criteria depending on the illness or condition that they're being assessed for, and so on and so forth. And if that is the case and they qualify, then they're given medications that end in their death by a physician. And so what the issue here is, so we've had this for a while here in Canada, and we've had this for conditions that are fatal, right? That are going to end in death, and going to end rather soon, as far as I understand it, in death. So it's like it's not a far jump for a lot of people to make. It's like, this disease or condition is going to end in death, but it's going to be a long and laborious and you know, a very unpleasant process to get to that death. And so this person wants to hasten that death, yay or nay. And people are like, well, you know, okay, maybe I don't agree with, you know, the idea of assisted suicide, because I don't agree with suicide, and we're going to get to that in a minute. But, you know, I can see it's going to end in death anyway, and they just want to make the death sooner so I can get there. Okay, so people can get there. Now the issue is they want to bring in physician-assisted what we're calling medical assistance in dying. So it's not called a physician-assisted death any longer here in Canada. It's called medical assistance in dying. And what they want to do is allow that for conditions like psychiatric conditions. They want to specifically allow it for psychiatric conditions, which are not in and of themselves fatal. I can hear some of you already arguing, but it is fatal if death by suicide is the result of a psychiatric condition. Yes, I know. But they are, the condition, the actual biological disease is not in and of itself going to result in death all by itself. And so this has got people now thinking. The other concern specifically with psychiatric illnesses is the idea of that the person has always had to be in their right mind, so to say. And so they've had to be able to understand the procedure, make sure, we have to make sure that they are not suicidal in order to get the procedure. So that's kind of a distinction there. And that they are able to make the decision to have the procedure while in complete control of their psychological faculties. And people are saying, well, you know, with psychiatric diseases, is this possible? They're saying, with psychiatric diseases, how do you know that the person's not suicidal? How do you know that they're not doing this because they're suicidal and they just They just want to die by suicide. And it's got people really up in arms. And so we had this proposal. We were given some time to think about it. The time passed. Nobody could come to a decision. We extended the time. The extended time, we thought about it some more. That extended time passed. Nobody could come to a decision. We've extended the time some more. And so what's happened this last time is we were supposed to have come to a decision, and actually the law was supposed to have been put into effect as of the end of March 2024. And the government of the day has actually put in a law that would halt that decision from being made, halt that from being put into place, and give us until 2027 to have a more fulsome review of all the laws and all of the medical precedents and all of the ideas, and to have more conversation and to really get a handle on it. What they're concerned about too is that the medical establishment doesn't have a protocol in place. So if this had come into force on March 31st, 2024, and someone had said, okay, I want medical assistance in dying, please, on April 1st, the medical establishment would have gone, don't know how to do that. So they want to make sure, I mean, not exactly, of course, the medical establishment knows how to do that, but they didn't have a protocol. And what I mean by that is they weren't sure how to assess a person that was applying based on their psychiatric condition, because they're not sure how to go about assessing that psychiatric condition against their criteria. And so we now have until 2027. Of course, those that are making the laws and making those medical rules and whatnot, they're going to be doing the talking. At least I hope they are. When I say that I don't think anybody's going to be doing the talking, what seems to happen is that every year or every however long it is that they give us to think about it. So we'll come close to the end of that period, and there will be a bunch of news stories where you'll get either people that are being interviewed that would want to be considered for medical assistance in dying. You get people that will be interviewed that would never want that to be a thing ever in life. You get, news stories on it. So you'll get that within like 3 weeks of the actual law supposedly going to be taking effect. And then it gets pushed for another year or for another 3 years or however long. And then nobody talks about it again until we hit another deadline. And so it doesn't seem to keep coming up for the general public. And so it seems to be like complete news to the general public each time we hit a deadline. It's like, what? What is this medical assistance in dying for psychiatric patients? And so I would love for there to be a more fulsome conversation. And the way I see it, it's not a cut or dried issue. Our medical establishment hasn't actually issued a statement one way or the other as to whether this is a thing that they endorse or a thing that they don't endorse, because it is a very, very complicated issue. And from a patient's perspective, which is what I'm going to speak on today, because I mean this could be a 2-hour-long video if we go into really all the philosophical and the medical and the ethical perspectives. We're going to go from like a patient's perspective, from my perspective. From a patient's perspective, when I heard that there was going to be a law put into place that medical assistance in dying for psychiatric patients, that was going to happen, one part of me was happy, because in some way it legitimizes the disease that I'm struggling with, and that others, not just me obviously, but that I'm struggling with. It makes it something that is real, that causes real pain. The pain is so real that people would consider wanting medical assistance in dying to escape that pain, that it is so real that there have been laws enacted to protect people from that. It legitimizes the actual, like, I mean, there are people still that say that psychiatry and psychiatric diseases are all in your head, not in the they're in your brain kind of sense, but that they're made up, or that you're just they're just kind of some figment of your imagination. And to have something like this put into place, it really says, no, see, it's real. So there's that element of, if every other disease or disorder is able to be protected in this way, but not psychiatric disorders, that doesn't feel good to me. That delegitimizes my disorder. So there was that element. Now, do I need there to be a law or medical assistance in dying in order to legitimize my disorder for me? Do I need that? No, I know it's a real disorder. But I feel like in the landscape, there's something about psychiatric disorders being recognized that way that causes legitimacy to be there. But on the other sense, I was really profoundly disturbed to see that this medical assistance in dying was going to extend to psychiatric disorders. And that's because I have been in a place more than one time with bipolar disorder. This is the lay of the land, right? You go into mania, you go into euthymia, and you feel great, you feel normal, you know you're living the life, and then you go into the depths of depression. I spend most of my time down there, and I've been in the depths of depression where I would have considered, I have been suicidal, and I have not died by suicide because of various reasons, one of them being that a kind of moral or ethical, I guess, in my own sense, that I did not want to die by my own hand, and dying through the medical establishment, which is kind of, was morally legitimized, definitely legally legitimized, whereas suicide is not illegal per se, but there are aspects of it. You lose your life insurance benefits, so on and so forth. I won't go into that, but there are aspects of it that don't seem so savory. But going the kind of the medical route seems legitimized. It seems legal. It seems clean. It seems painless, right? And a sure thing, whereas methods of suicide often don't. So I would have considered medical assistance in dying for those reasons. And then I came out of it again. And then I went back into it again, and then I came out of it again. And then, who knows, I mean, this depressive episode, we could be going there again. And, I mean, if future behavior is predicted best by past behavior, we will come out of it again. And that's my disorder. That's not everybody's. That's not everybody's experience. Some people have been in deep depressive episodes for the past, 20 years, and does it look like they're coming out of it? No. But is there no hope? Can there ever be none? And so I look at it and I say, wow, if I had done that for me, this is my story. If I had done that at that time when I was sure, and I was very compos mentis, and I was very, rational, and I was, whatnot, and so on and so forth, it would have been a mistake. And I worry because psychiatric disorders do not have a sure course. And we do not know enough about what makes their course go in what direction to ever be sure about what way we're going. And so even if you've been in a depressive episode or in a suicidal state or in a hopeless state of whatever description for 5 years, there's nothing saying that in the 6th year you won't come out of it and come back to your euthymic self, your a self that is enjoying life, a self that would regret medical assistance in dying, in a way that someone who is on a sure course towards neurodevelopmental or neurocognitive ruin, for example, they're not going to come out of that. Right? And so I worry about psychiatric disorders. I worry about what that tells people about psychiatric disorders and the hope that we have in treating them and in being able to eventually cure them one day. The hope that we have in being able to assist people even at their darkest. And so I wrestle with these two. And I recognize that there are people that legitimately are suffering, that have been suffering, that are by all stretches of the imagination going to continue to suffer, and that by their account, and maybe by my own, I'm not sure, because I don't know them specifically, but by their account would benefit from medical assistance in dying because of their psychiatric disorder. I know that those people exist. I have seen them on the news. I know that they exist. And who am I to say, no, you're wrong, continue to suffer because of my ideals? And yet it sits with me completely uneasy to say that psychiatric disorders are the type of illness, the type of disorder that should lead to medical assistance in dying at this stage of the science that we understand these disorders. And it's unfortunate that someone's suffering should have to come down to our medical or scientific knowledge of a disorder. But I think in this case, it might. Because if we are going to take that medical and scientific knowledge and understanding and use it to end someone's life, which we can't take back, we can't undo, we would have to be very, very sure that that medical and scientific knowledge and understanding knows what it's doing. And in terms of the field of psychiatry, it's still a very young science. It really is a very, very young science. And I honestly don't think that it's at the stage where it can confidently say that it knows that someone should be eligible for medical assistance in dying. But it's complicated. This is a complicated question. Unfortunately, it looks like the wheels are in motion for this to pass, for this to go through. It just keeps getting pushed for whatever reason. Partly so that we can be ready when it does go through. And that is disturbing. And that's why I think this conversation needs to continue, and needs to continue at the level of the public, so that people are not surprised when we get to 2027 and they say, okay, here we go, it's open for business, and everybody goes, what do you mean? It's too late. It's too late by then. The time for input is gone. The time for conversation, the time for dialogue is gone. So we've got another chance. We've got another 3 years to have this dialogue. You can write in to your MP. That would be one way of getting your voice heard. Or alternatively, I mean, you can get involved when there are conversations on it. So I can try to keep you posted when I see those conversations happening. But writing into your MP would be your best bet if you have thoughts on this topic. So that is this week's video. Take care of yourselves this week. It's a short week for many of us. I hope that you enjoy the extra day of rest, if nothing else. And I will see you in my next one. Bye.
StigmaCrusher.